Let's talk now about the thyroid gland. And the thyroid gland is its position is sitting on the trachea. It has two lobes connected with isthmus, okay, and it has follicle. So like those circles, we'll see them under microscope in the lab. At the back side of the thyroid gland, we have 4 to 8 small glands. We'll call them the parathyroid glands. Those are the parathyroid glands. Also, we'll talk about. But we'll start talking about the thyroid gland. The thyroid gland produces 2 hormones. The first one and the most important one is the thyroid hormone. The thyroid hormone is important because it regulates the basal metabolic rate in the body. What does this mean? It means this is how much energy is needed when cells at rest. Okay? How much energy is needed or how much energy is spent when cells at rest. So that is the basal metabolic rate. The thyroid hormone comes in 2 forms, T3 and T4. The 3 and 4 refers to the number of iodine ions within the structure. So the thyroid hormone technically is 2 things. It's a protein, which is the thyroxine, and 3 or 4 iodine ions. So usually the T3 is the important one, is the active one. But the thyroid gland sometimes it produces in forms of T4, like this is inactive. So this is a way of preserving it, so it doesn't get consumed immediately. When cells take the T4, they have to convert it to T3. Okay, by removing 1 iodine ion. So what does it do again? It influences the basal metabolic rate, the amount of energy used by the body at the rest. Also, it will initiate the transcription of genes important in glucose oxidation, which is producing ATP from glucose. And this hormone therefore is extremely important in tissue development, especially in fetal and childhood. It's extremely important, and we will see what will happen when we don't have, especially in pregnant women or moms, when they don't have enough thyroid hormone. There will be sometimes severe consequences of that, because it's critical in the development of the nervous system, even when the baby is in the uterus or in the early childhood. So the thyroid hormone, low levels of the thyroid hormones will affect the development of the nervous system. Low levels of the thyroid hormone also will affect the reproductive system by affecting the reproductive hormones, and therefore it might cause insufficiencies or low libidos, low fertility, and other aspects of reproductive functions. It will affect the body sensitivity to adrenal medulla hormones like epinephrine and norepinephrine, the sympathetic, the parasympathetic responses. It will affect that. So this is an important hormone. Now, for the problems with the thyroid hormone, it could be because either we have a problem in the protein, or usually it's the problem in the iodine itself. So in old days, when people, they did not know at that time that iodine is so important, there was sometimes insufficient iodine in the diet. And those people, when they have it, they will develop something in their thyroid gland called goiter. So this is enlargement of the thyroid gland. Why? This is a sign again of iodine deficiency, that the thyroid gland doesn't have enough iodine to release all of the thyroxine. So what's happening here in the body, that the body asks for thyroid hormone, let's say the T3. The thyroid gland gives the thyroxine, and we said the thyroxine needs 3 iodine ions, right? But if there is no iodine ions, then we will just store the thyroxine. So the thyroxine would get accumulated in the thyroid gland. And sometimes the thyroid gland would multiply its number of cells. So because there is always a demand for the iodine. So think of it like this. The thyroid gland thinks that I have a low production of it, so I need more of the cells to produce the thyroxine. But the problem is the presence of iodine. Now this turned not to be a big problem now, only maybe few places around the world, because they started to add the iodine to the salt. So if you go to the shop and you buy salt, very likely that you will find it iodinized salt, to add the iodine, an important element for the function of the thyroid. Now, in case of this iodine deficiency in infant and during pregnancy, again, as we said, it will lead to impaired growth and development, decrease in fertility, and sometimes prenatal and infant death. So usually iodine deficiency is a primary cause of mental retardation, and this is preventable. It can be prevented just by giving iodine. And now with if the baby is born and their moms have iodine deficiency, that might give a condition known as neonatal hypothyroidism or cretinism. And here we have conjunctive defects, short stature, deafness, blindness, muteness, all happens in those kids when their moms have iodine deficiency through pregnancy or during pregnancy. Sometimes we have a problem in the production of the thyroid hormone, not necessarily associated with the iodine, but there's a problem in the gland. So that's when we call it hypothyroidism. So this is low levels of the thyroid hormone. This will be characterized by low metabolic rate, weight gain, cold extremities, reduced libido, irregularities in the menstrual cycle, constipation, mental activity, reduced mental activity, all of this because of the low thyroid hormone levels. On the opposite hand, if we have hyperthyroidism, this is something known as a Graves' disease. So it's almost the opposite. Increased metabolic rate, excessive body weight, weight loss, diarrhea, increased heart rate. This is usually there is, in those patients, the eyes will get bulged as being pushed away or pushed out. In this case, with the hyperthyroidism, this is like a marker of the eyes of the hyperthyroidism. Sometimes goiter will develop as well in those conditions. The other hormone from the thyroid gland is the calcitonin. And calcitonin is important in regulating calcium levels. And in fact, since we will talk about calcium levels, let's talk also about the parathyroid gland. Parathyroid gland, the main hormone that is produced from there is the parathyroid hormone, the parathyroid hormone. And this hormone also regulates the calcium levels, So let's put them both side by side and see how calcitonin and parathyroid hormone regulates the calcium levels. Let's assume that this line is the calcium homeostasis. So in case we have high levels of calcium, calcitonin is produced from the thyroid gland. Calcitonin will do several things. First one is activating osteoblast. And if you remember, those cells are responsible for bone formation. So technically, calcitonin would ask for more bone formation. And if you remember, bone needs calcium. Calcitonin also, it will inhibit osteoclast cells. Those cells are responsible usually for breaking down bone, breaks bone. Calcitonin inhibits calcium absorption from kidneys and also from small intestine. So here kidneys let it go to urine, So collectively, all of this would reduce calcium levels. Now, what about if we have low levels of calcium? In this case, the parathyroid hormone is secreted from the parathyroid gland, and the parathyroid hormone almost will do the opposite of the calcitonin. First one, activate osteoclast, break down bone, inhibit osteoblast, so no bone formation. Ask the kidneys to absorb calcium. Also ask kidneys to release vitamin D. Ask the small intestine to absorb calcium. The vitamin D will target the small intestine and help or promote calcium absorption. So collectively this would restore calcium levels. If you remember in AB1 we talked about calcium is very important. We saw it in the function of the skeletal muscles, we saw it in the function of the nervous system, and in AB2 we'll see it in the function of the heart. So calcium is extremely important. That's why we cannot afford having low levels of it. So usually people who have their thyroid gland removed because of a cancer, usually the parathyroid glands are also removed. So those people will receive supplements for the thyroid hormone, and also they will receive supplements for the parathyroid hormone, but very rarely that they will receive any supplements for calcitonin. So in this case, we will have sometimes hyperparathyroidism, that is like overproduction of PTH. This means that we have excessive calcium reabsorption of bone, decreasing bone density, that would increase fractures and deformities or deformations of the bone. That might affect also the permeability or action potentials of the nervous system, and it will come with so much problems. Similarly, if we have low calcium levels, it means we have more deposition of bones or more creation of bones, and sometimes it will lead to irregular bone formations. But Importantly, it will affect the functions of the muscles, the function of the nervous system, and sometimes in severe cases it might be fatal because we are losing the functions of the heart in case of low calcium levels. Okay, I will stop here. In the following video, we'll talk about the adrenal gland.